Hi, I'm Dr. Rushabh Parikh. I'm a structural interventional cardiologist working here at Mehta and Sir K Cardiac Institute. My job basically involves treating heart patients, and my expertise lies in coronary procedures, and apart from that, structural procedures like minimally invasive valve replacement surgeries.
What is the most remarkable case or the closest one to your heart?
That is actually a tough one to pick one. I would say the most special case would be the first TAVI that I did. TAVI is a minimally invasive heart valve replacement without an open heart surgery. It was an elderly gentleman who was very short of breath, and immediately post surgery, within 2 days, no pain. The patient is walking around, and it's just fantastic to see patients recover this quick.
So, sir, what are the earliest signs or symptoms of a heart disease that people usually ignore?
That's a very important question in today's world. The earliest signs of heart trouble could be as simple as fatigue, some sort of shortness of breath, some swelling in your legs, and these could be subtle. We might mistaken these for just certain age-related problems, but that is not always so. So we need to be very aware of what our symptoms are. Any heart diseases, the most primary symptoms comprise of some sort of chest discomfort, which can also present with some sort of an acidity like symptom. The other being shortness of breath or swelling in your leg. Third being dizziness and having episodes where you feel like you're going to faint. And the fourth being an unusual awareness of your own self heartbeat. So these are probably the cardinal symptoms which one should be aware about.
How dangerous can BP be if left untreated?
Untreated blood pressure, or what we call it as hypertension in medical terms, is something which needs to be taken care of. We call this a silent killer because this is something that will be detected only if you measure your blood pressure frequently, get regular checkups done. Increased blood pressure can not only affect your heart, it can cause a heart attack, it can cause a stroke, it can cause injury to your kidneys, and it can also lead to heart failure. So blood pressure is something that we really need to manage, and we need to detect it quick and make sure that the bad effects of a higher blood pressure are taken well care of.
Can stress alone trigger heart problems?
Yes, absolutely. Chronic stress does play an important role in heart diseases. Stress leads to release of certain hormones and adrenaline, which in turn can increase your heart rate, can increase your blood pressure, and cause injury to your heart on the long term. So stress is something which we should really be aware of. Stress can also lead to lack of sleep, irregular food habits, a sedentary lifestyle, and these are things which keep adding on towards poor heart health.
What are the simple habits a person can adopt for a healthy heart?
So the simplest habits to adopt for a healthy heart is to get moving. 30 minutes of exercise for just 5 times a week is what we should absolutely start off with. We need to eat right, absolutely no smoking. Smoking in form of cigarettes or hookah or vapes is an absolute no. And these are certain lifestyle changes which need to be adopted for our heart to be healthy, and make sure that we don't face any trouble related to these factors, which we can control quite easily.
How important is routine cardiac checkup after the age of 40?
Excellent question. After 40, a routine cardiac checkup is something that should be adopted and should be undertaken by everyone. A simple test like an ECG can give us a lot of information. Occasionally, if needed, the cardiologist can ask you to get a 2D echo, which is a sonography of your heart, or a stress test where we make you walk on a treadmill and we record your ECGs. And this can give us a wide array of information and help in early detection of any cardiac diseases.
Are heart attacks only a men problem?
Absolutely not. Heart attack is something which is quite prevalent in women also. Rather, globally, if you look at the statistics, heart diseases contribute to the highest number of death in women. The only difference being that women typically don't present with the symptoms what men do. So there might not be an underlying chest pain or a big shortness of breath, but they might present with chronic fatigue, weakness, some sort of an acidity. So symptoms are a little vague when it comes to women as compared to men in terms of heart health, and this is why a lot of times we ignore them, and that can lead to trouble.
How can diet directly impact heart health?
So diet is very important to your heart. Consider diet like probably your first prescription. So what you eat, what goes in is what affects the heart. So limiting your salt intake, making sure that you don't have a lot of processed food, make sure that you don't have a lot of trans fat. So maybe you cut down on oil, fatty foods, fried foods, processed dairy products. It becomes quite essential to curb these things down, because in turn our food habits, they reflect towards the better health of our arteries, and in terms towards better cardiac health.
One myth about heart health you wish people would stop believing.
One myth about heart health what I would wish people would stop believing is that heart diseases happen only in the elderly. This is absolutely untrue. Time and again, we've seen younger people get affected by heart diseases. We've heard of celebrities getting heart attacks, athletes who get cardiac arrest. So, heart health is important to everyone across all age groups, across all sexes, and this is something that we should never underestimate.